There we go.
Good afternoon. Dr. Cunningham and I are here again today to talk about another healthcare funding delay that could have severe consequences for county residents. Today I want to provide an overview of the urgent needs facing both our specialty tuberculosis clinic and our sexual health clinic, as well as some other budget concerns for other important key county services. Last month, the council finally approved funding to keep the nurses in the Juvenile Justice Center and in the jail to provide health care for adults and children in our custody. However, that funding was only made available by the council after we asked the community to engage, to raise their voices, and contact our county council members and ask them why they were risking lives. Now our specialty tuberculosis clinic is at risk of running out of the drugs to treat tuberculosis patients, jeopardizing the health of those patients and members of our community. At the same time, our sexual health clinic needs $9,000 urgently in a budget transfer to cover medical supplies, educational materials, and medications to prevent and treat sexually transmitted diseases. And what has become a familiar refrain this year, the Department of Public Health submitted transfer requests to the County Council in May after the county cut money from the budget to purchase these important supplies for patients. And they cut that from the 2026 budget back at the beginning of the year. Now we're asking the council to approve a transfer of $13,000 for TB treatment and $9,000 for sexual health treatment. The money's already in the budget, but the laborious process that's been approved by the county council requires us to ask them for permission to access these funds. So I asked Dr. Cunningham to talk about the importance of the TB specialty clinic and the sexual health clinic. Okay.
Thank you, Dr. Page. When people hear about tuberculosis, they often assume that it's a disease of the past. However, the reality is that tuberculosis still exists within our communities, and sometimes it can become resistant to the medications that normally treat it. That makes it much harder and much more expensive to treat and poses a significant public health challenge. So why are we making a big deal about this funding? This isn't just about treating one patient, it's about protecting an entire community, and we've seen an increase in those being treated for TB over the last year. Tuberculosis is an airborne disease. If someone with drug-resistant TB cannot complete effective treatment, they can remain infectious for longer and increase the chance of infecting others, including loved ones and close contacts. The alternative to not treating these cases of TB does not mean the problem goes away. For the non-clinical people, treating people with latent tuberculosis infection is a crucial part of our public health program. About 10% of those cases will go on to develop active TB, and about half of them will develop active TB if not treated within 2 years. Without effective public health programs in place and support, patients can become seriously ill, require lengthy and costly hospital treatment, and remain at risk of spreading disease to others. Those additional cases could place greater demands on our hospital systems, healthcare providers, and public health services. Turning to our sexual health clinics here in Pine Lawn, the need for funding is equally urgent. The St. Louis metro area is among the top 10 in the nation for gonorrhea and chlamydia cases. The funding transfer we've requested will cover medical supplies, educational materials, and medications to treat and prevent sexually transmitted diseases. Without this funding, we are at risk, undermining our ability to protect the health of our community. The health department is often invisible when it's working well. The measure of a public health system isn't about how it responds to an outbreak. It is how many outbreaks the public never has to see. I want to be clear that my department is only asking for these transfers to be approved. I'm not asking for new funding, and we have the money in our budget to cover these costs. But we need the county council's approval. With that, I will turn it back over to Dr. Page.
Thank you, Dr. Cunningham. I want the community to understand how we got here. The Department of Public Health submitted their budget back in October of 2025. This is for the 2026 year. And in December, the council chose to cut this funding from the budget without understanding the consequences or the impact in the community. And now several council members have let the Budget Committee chair decide what happens with transfers and supplemental appropriations. And that's gumming up the system. And I said when we talked about funding for nurses in the jail, and I asked the county council again, why did they cut this funding from the budget? And I asked our media partners to do what they do best. Ask the hard questions. Ask council members this question: how long are we going to keep fighting over nickels and dimes in the budget while we refuse to have a larger conversation about the structural problems and the long-term financial health of the county's budget, which has been going on now for 15 years? Because the priorities of the council now raise serious questions. Today we're pleading for $13,000 to treat patients with tuberculosis, $9,000 to treat patients in the sexual health clinic. Cutting or delaying this fund doesn't do anything to address the county's budget challenges. It doesn't address the structural issues of a budget. It only creates unnecessary care for people who have serious health care problems. But these are just a fraction of the budget transfer requests currently in front of the county council. The Department of Human Services has 12 transfer requests in front of the council, including one for $25 for car allowance. The cost and staff time of processing this single request far exceeds $25. Yet this is necessary under the council's new rules and processes and procedures for budget transfers. It's creating unnecessary work, it's delaying important decisions, it's consuming staff resources. And we have to ask, is this a reasonable use of staff time? And is this seriously helping folks in the community? Here are some of the transfer requests in front of the county council. We mentioned $9,000 for sexual health, $13,000 for tuberculosis treatment, $25,000 for car allowance for a home improvement program, $319 in the family court for the domestic violence program, $1,225 in the drug court for recovery books in family court, $4,500 for community meetings to keep children out of juvenile detention, $12,000 for the full accreditation of the Wyman's Shelter for domestic violence, $15,000 to buy kitchen supplies and mattresses at the Wyman Shelter, $481,000 for community block grant funding, $82,000 for the community development block grants, $711,000 in federal grant money for human services, $635,000 to buy supplies to plow snow and fix the traffic lights and guardrails, $256,000 for the fire alarm in the county buildings and plumbing and lights and air filters, $50,000 to cover mileage and transportation in the public works and code enforcement. These are historically routine function of county government, routine transfers. We've been asking for these now for several weeks, and it's gummed up the process. There are also several requests for supplemental appropriations, including one for the Parks and Recreation Department for $90,000 to buy pretzels and popcorn and concession stand items for the Creek or Lake Soccer Park to sell at the concession stand. Purchasing these items and selling them actually brings money into the parks budget. At the same time, the council has prioritized pay raises for future elected officials, the future county executive, assessor, prosecuting attorney. In fact, there's new legislation in front of the county council at tonight's meeting to raise the pay for the county auditor, a position that the county council hires. They do this while proclaiming from the dais that we have a severe budget crisis. So the public should ask, where is this meaningful, serious conversation about the actual causes of our budget challenges? Where are the solutions? It's easy to criticize individual expenses. It's much harder to sit down and have a civil conversation about the difficult structural budget problems that have plagued county government for 15 years. The difficult decisions that we have to make moving forward. Unfortunately, this pattern of refusing to communicate goes beyond the budget. The county council chair continues to withhold important communications from my office from the public agenda for the county council meetings. So residents and our media should ask, why? Why is information that affects the citizens and public services not openly discussed? For example, I sent a letter to the council chair that the Proposition P fund, the sales tax passed in 2017 for public safety, that fund has a $40 million deficit. That's information that the public deserves to know, and we should be having a serious conversation about it. But instead of allowing that conversation to happen, it was also withheld from the county council agenda. Residents also deserve transparency regarding the concerns about the treatment of county employees and residents, including allegations of unprofessional and threatening behavior by Councilwoman Webb. Those communications from my office were also withheld from the public county council agenda. At a time when St. Louis County and the state of Missouri are facing severe fiscal challenges and budget crisis, the focus should be on educating residents about the structural long-term problems in our budget. One of those challenges is reflected in the public vote on the use tax on the August primary ballot. This would bring an additional $75 million into the county budget and address the structural problem we have with our budget. This is a significant issue, and the public deserves a conversation by its elected officials about what would happen, especially with the public safety budget, if this money is not available. Instead, the focus in county government has been fighting over $13,000 to treat tuberculosis and $9,000 for the sexual health clinic. Good government requires a balance, so I have to ask, are these new processes serving the public, or is it creating unnecessary red tape that is essentially a power trip for one elected official? The council should revisit these processes and procedures that are consuming county resources and look for a better approach to routine financial decisions in St. Louis County. We can protect accountability while respecting the time and resources of county staff. This conversation is getting much more urgent because the budget process is starting for 2027. In 2 months, we'll be submitting our budget for the 2027 year. We should be focused on the future. We should be having serious and honest conversations about revenues and revenue sources for public safety, for public health, and for the critical services that St. Louis County residents have expected and come to expect. St. Louis County deserves a government that's spending time solving problems, not creating new ones. They deserve leaders who are serious. I'd be glad to answer any questions.
How has the new format, if you will, where you'll only meet, or your department heads will only meet with the CDLs in public meetings, complicated things even further?
We'll be glad to meet with the council members in public meetings. We have to meet in public meetings because one of our council members threatened one of our department heads. And we can't, we have to have that sort of interaction out in public. We're not gonna have our department heads badgered in meetings and ask repetitive questions of the same information over and over when it's been given to them. And that's another reason why we're going to record the meetings and transcribe them, so the public can see the questions that are being asked and understand the information that has been made available to our council members over and over and over. We are happy to provide information. We had a public meeting 3 weeks ago when one of our department directors was available to answer questions about items on the budget, and they weren't even allowed to speak. So we'll be glad to visit with the council members. We'll be glad to give them all the information that they want, but they are also accountable for being prepared for those meetings, for asking thoughtful questions, and for participating in a meaningful way in the conversation, not just badgering our department heads.
Has this been the status quo all year with these small dollar budget requests, some of them as small as $25 that you said that you have to get permission, or is that something new in recent months?
The question is about the transfers, and the county council has initiated new procedures this year which require the approval of transfers in grant programs, which has never been done before. And we're seeing the tip of the iceberg about how that is going to gum up the processes of county government. Instead of our employees spending time helping people who want to interact with county government and answering their questions, we're spending time finding the paperwork and the administrative time required to present transfer requests for as little as $25 for a county council to have a budget committee meeting on, and a meeting with the department head, and then a public meeting to approve that transfer.
But they've been doing that all year with these transfers? Because it feels like we ran into this more so recently.
The process has been in place for this year. The transfers are just now coming to a head because we're halfway through the year and we're running out of money in some of these funds. The process that they have identified to move money takes a lot of time. So now our department heads are going to be running around trying to present these transfers for $25 or for $300 or whatever it is to the county council for a grant program to be approved. So these extraordinary processes are going to consume an enormous amount of time. It's not just the time, it's the delay in getting the money. So 2 weeks ago, we had an emergency in the jail that created a crisis in our community because of the time delay between the request for the money that was cut, the budget cut that was never even understood when it happened, the request for the money that was cut that was delayed. So now we have a pile of requests in front of the county council for today's meeting, and we need to get those moving. And since the county council won't sit down and talk to my staff about this, we're going to communicate with the public and let the public communicate with the council about how important these services, tuberculosis, sexually transmitted diseases, all these other important services that the county Department of Public Health provides, that the county public wouldn't even know about unless there's a crisis.
Dr. Cunningham, while you're here on an off topic, I have no idea how to pronounce it, but there's that parasite that's going around that's causing explosive diarrhea. Is that in Missouri yet, to your knowledge? And if so, is it in the St. Louis region at large, or maybe a neighboring state that you're aware of?
Yeah, it's not in the St. Louis region just yet, but we do meet with the state. We're following this really closely, so we are prepared if it ever comes to the region, but right now it is not here. It is kind of spreading rampantly in the Midwest, and so hopefully that we'll be able to get this contained. When I say we, meaning the healthcare industry, we'll be able to get this contained. But as of right now, St. Louis County and the region, we are okay as I speak right now.
Is it in the state though?
I have not heard of any cases in the state just yet.
Any recommendations for people to try to avoid this, or?
I don't have any recommendations just yet. Sorry. I'm focused on STI and TB, but no recommendations just yet. we will continue to monitor, and my department will put out information as we continue to learn more as well. So a lot of it is still developing. There's still some investigation. One thing I will say, because of the cuts that happen with the CDC, there is significant delays, and even on a national level, we're getting information down to local public health agencies. So what we are dealing with, we are directly being impacted by the national cuts. Therefore, it is delaying information getting to us. But I think we're doing a great job at trying to communicate as best as we can. But we also can't act like these federal cuts does not impact us locally. So the getting of communication, I would say, has been a little bit of a delay because of the